Welcome to today's webinar. We will be discussing the role of regional organizations and processes that enhance decision-making in the Africa wash sector through the use of data. My name is Richard Razier. I'm the project director, or if you will, the chief of party for the U.S. Agency for International Development funded Water for Africa through Leadership and Institutional Support Project. Welcome everyone to the webinar. Currently, you're all muted, so you'll check out the many functions in this GoToWebinar platform. There's a place where you can type in your questions as we go. WALIS is pleased to be hosting today's webinar in coordination with the USAID Water team. I'd like to give you guys a brief overview of the WALIS project right here on the next slide. So the Water for Africa through Leadership and Institutional Support is a 5-year project that's implemented through funding from the USAID Africa Bureau. Our main objective is, as you can read there, to strengthen the leadership of the African institutions that are working in the wash sector, to improve governance, evidence-based monitoring, and peer learning. We are currently, or have worked in 10 different Africas throughout countries. We've worked in 10 African countries with either organizations or the national government themselves. And those activities have been along those 3 buckets of work under stakeholder engagement and thought leadership. What is very applicable today is the Improving Wash Evidence-Based Decision-Making program we're running. And then, of course, working quite a bit with the African Ministers' Council on Water on a variety of tasks. To talk about our presentation today, I'll go over a few points, and then I'll introduce our speakers today. So there's broad consensus that to improve the impact of investment in the wash sector and governance of that sector, that what we base our decisions on is key. When it comes to policymaking, budgeting, planning, and implementing in this sector, we've begun to clearly mainstream evidence in our decision-making. Now, does this mean that all decisions are made by carefully researched and tested processes that rely exclusively on data? No, not at all. That would reject the reality of history, politics, and forces much larger than the sector itself. That being said, there have been and are massive efforts to develop methods and systems to gather, store, and disseminate wash performance and sector data at all levels across Africa. We know that wash information platforms, whether subnational, national, or more broadly, hold the power to shape national priorities, provide transparency and accountability, and inform investments in infrastructure and people, while at the service provider level, data can help utilities and entrepreneurs improve service delivery and reduce waste. The power and promise of data is immense, but are we seeing data used by decision makers to inform decisions? And if not, how do we, as wash practitioners or donors or national agencies responsible for these decisions, support the use of monitored data in the decision-making process? Early research suggests that it might be less about the quantity and quality of data and more about the human resources and the institutional capacities, the arrangements between agencies and implementers, and incentives that govern and determine whether data informs decisions. This webinar will explore what factors enable or hamper the use of data in decision-making, and how we can support the use of data in that decision-making. The role of regional institutions is clearly very important to building the right incentives and the culture for this data-driven decision-making across the countries. So what you guys can expect today, the 94 attendees in this webinar, is we're going to have 3 15-minute presentations, followed by a question and answer session with these presenters. The 3 presenters are Marika Adunk from IRC, Nick Dickinson from WashNote, and Kitch Bawa from the African Ministers' Council on Water, or as we know, AMCAP. During the webinar, all the participants, so all of you guys that are listening to me now, will be on mute, but you can submit your questions to the question box on your control panel. So if you navigate there to the right side of your screen, usually you'll have you'll be able to find a question box and be able to submit those questions. Anytime during the webinar, submit those questions, please. The questions that you submit will go out to the entire audience. And then the discussion at the end, we'll facilitate a discussion at the end. So the question and answer session, and we'll work through those questions as best we can. So everyone knows we're recording the webinar and we're going to repost on globalwaters.org. So if you don't get a chance to hear everything or you want to re-listen, you can go there. You can also share that webinar with others. Also, the presentations that each presenter is going to be using, those are also going to be posted there. Our first presenter is Marita from IRC. She's in Ethiopia, so she's pre-recorded her presentation, which we're going to play now. She's online, and she'll participate in the Q&A after the presentation. Let me give you a quick bio on Marita. She's a WASH expert from IRC's International Department. She's based in the Netherlands, as I said. She's currently in Ethiopia. She's worked in the WASH sector for over 15 years on a range of issues, but especially on sustainable provisions of rural and small town water services and the systems and mechanisms needed for this. So without further ado, Marita, we're going to hand over the presentation is going to play, and then after that, I'll introduce the next speaker, so forth.
Thank you, Richard, and thank you for this opportunity to present some thoughts and initial findings from my work. I'm trying to get better understanding and insight into the use of monitoring data in decision-making processes in the WASH sector. Fair to say that over the last decade or so, we have seen an increase in the availability of monitoring data in our sector. This includes data at service provider level, where decisions are made about day-to-day management of water schemes and about plans for the future. For example, by people like this hand pump mechanic in Uganda, and this small town utility manager in Ethiopia, and the cashier from the same utility. But data and information are also produced at service authority level, where decisions are made related to the support and regulation of service providers. For example, by this regulator, and by local governments like these Ghanaian district representatives who are celebrating the implementation of a master plan that they developed with other local stakeholders at this level. And there's monitoring information at national level, where decisions are made about resource allocation and policy making, for example by the Ethiopian Minister for Water, or these national level stakeholders in Sierra Leone, deciding on the direction the sector has to take for the next year during this annual review conference. And finally, data is developed at international level, where priority setting is done, for example, by the African Ministries Council for Water, so AMCOW. So the increasing amount of monitoring data obviously has the potential to inform all these decisions that are being made at these different levels. But does that happen in reality? Is monitoring data actually being used for informing decision-making processes? So before diving into that, I would first quickly like to explain what I mean with use of monitoring data for decision-making. With monitoring data, I refer to both data itself, the facts and the figures, as well as the information products that are created from this data. And specifically to data and information which are produced on an ongoing basis, so rather than a one-off assessment. So decision making covers the wide range of decisions that I've just talked about at the different levels. And monitoring data can be used for both accountability purposes, but also for improvement, for informing improvement. When it's used for informing improvement, it can be used in two different ways, or actually three. First of all, instrumentally, informing how things can be done better in better ways, but it can also be used conceptually. So kind of challenging the ways that we think about how things are happening, so helping us to get better insight into how things can be done differently. And monitoring data can also be used symbolically, just to justify already made decisions. But in this presentation, I'll focus on instrumental conceptual use and use for accountability. And I will do that by introducing a case for monitoring data in small town water supply in Ethiopia. So this figure in this slide shows how monitoring data is produced at different levels and how it is being used at these different levels. It's through literature review, including grey literature review, and a series of semi-structured interviews at different levels, I found that the use of monitoring data was mainly limited to instrumental use at service provider level by town water utilities themselves. And I observed that there was some limited instrumental, conceptual, and accountability use at service authority level, and mostly limited accountability use at national level. So as you can see, not the amount of use that we would hope or expect from this data. And I don't think this lack of the use of monitoring data is unique to the small town water supply sector in Ethiopia, but I think that's something that we see in many other contexts and many other sectors, and I'm sure you will recognize this from your own experience. So in order to get better understanding of why is this monitoring data not being used? And to find out what we can do better in order to improve the use of monitoring data, I want to better understand the factors that contribute to whether or not monitoring data is used. So there are different models for trying to understand the use of data in decision-making processes. The first one I looked at is the linear model, which presumes rational decision-making. And the assumption is that if the right data is produced and it's well packaged, that it will be used as well. And whether or not data is produced will depend on other factors as well, including capacity factors and motivational factors. So the capacity of stakeholders to collect data, process data, and the motivations they have for doing so. So the second model that I've been looking at is the relationship model, which assumes that there needs to be good relationships and links between data producers and users, and if that is there, data will be used. And the final model, and the model I will focus on for this presentation, is the systems model. And under this model, we look at the data use as a system of actors and factors which are interrelated. This includes the data characteristics that are so important in the first model, but it includes also the institutional and the trust relationships that are so important in the second model, but it also looks at other factors, and it also looks at how these factors influence use of monitoring data, but also how they influence each other. So the factors I've been looking at include data characteristics. And these include the quantity of data. Is there enough data? The quality of the data. Does the data reflect the reality on the ground? The timeliness of the data. Is data available when it's actually needed, when decision-making processes are happening? And accessibility of data. Is data available to people who need the data for decision-making? Or is it on someone's laptop, or is it in a paper that's in a closet somewhere that is locked? Or so is it available to the people that need it? And data relevance. Is the right data collected, and is it relevant to decision-making processes? So these are the data characteristics that I think form important factors of whether or not data is being used. But beyond that, there's also capacity factors. There's the individual capacity, the capacity of individuals to interpret and to use data for decision-making processes. And there's also the capacity at organizational level, including whether organizations have the financial and logistical resources to act on the information that comes from monitoring data and on the decisions that are being taken accordingly. And also the data and information systems that are available in organizations. Are the right systems available for that support decision-making processes, for example, decision support systems? And are the right institutional capacities there? And with institutional capacities, I mean the capacity beyond organizational capacity, and then especially referring to relationships and trust relationships between different organizations. And then finally, there are the factors related to motivation, which form important factors to whether or not data is being used. These include incentives, external incentives. Are there incentives for people to actually make use of monitoring data for decision-making processes? But also, do they have the internal interest in doing so, in looking for information, in looking for monitoring data in order to inform decision-making processes? And finally, is there a culture, an evidence-based, a culture of evidence-based decision-making? And all of these factors together influence whether or not data is being used. So these factors do not influence just the use of monitoring data, but they also influence each other. Based on interviews I've done so far related to monitoring data use in small towns in Ethiopia, I've started assessing how I think these factors influence each other. So here in the columns, it shows the factors being influenced, while in the rows it shows the influencing factors. So for example, here we can see that better accessibility is expected to have a big influence on institutional capacity. So if there's better access to data for different organizations to have access to each other's data, then we expect that it's very likely that that organizations will have better relationships with each other and trust relationships will be better. While on the other hand, data accessibility is not expected to have a direct influence on incentive structures for data use. So based on this assessment, we can plot the different factors in a matrix with increasing dependencies on the horizontal axis and with increasing influence on the vertical axis. So the leverage point in this matrix can be found in the quadrant with the low dependencies and high influence. So in the quadrant on the top left in this matrix. So now when we put in the results from the influencing and dependency matrix, this gives the following tentative results. So it's very tentative based on the interviews that I've done so far. But what we see from here, you can kind of see three big clusters with the data characteristics in the lower quadrant and the capacity, most of the capacity and motivational factors in the quadrant with the leverage points. So it seems to suggest that although it's very important that we get the data right, and I want to be very clear on that, it is important that we get the data right, and we still have a lot of work to do in that area. But in addition to that, we also have to focus beyond that. If we really want to ensure the use of monitoring data and evidence-based decision-making, we have to take into account and we have to address issues like culture and incentive structures related to data use. We have to take into account individual capacities to interpret and to use data, and organizational capacities related to financial and logistical resources needed for acting on evidence-based decisions, and institutional capacities, including the relationships and the trust relations between organizations. And these are, I understand, these are not easy to address. But if we manage to do so over time, then these are very likely to have a big positive influence on evidence-based decision-making. So with these rather big challenges ahead of us, I would like to conclude my presentation and thank you very much for your attention. If you'd like to read further on this, then you can have a look at the blog for which the link is indicated here. And for further comments, questions, inputs, and feedback, please contact me on the email address indicated here. And with that, it's back to you, Richard. Thank you very much.
Great. Thank you, Marika. That was an excellent presentation. I really liked you digging into the systems model, especially the three elements of data: characteristics, capacities, and motivation, and then where you found the greatest influence and dependence. We're going to move on to our next presentation, which is also pre-recorded. I just want to quickly remind everyone you're able to ask questions. We already have one question up there right now, but you're able to ask questions by typing them into the chat box. So the next presentation is by Nicholas Dickinson. He's the leader of WashNote. He's also an associate at IRC and has been supporting country-led monitoring and evaluation of water and sanitation services at national and district or municipal levels, where government, civil society, and private sector set the monitoring agenda and the questions to be answered. So I think this is going to be a really another very interesting presentation. So you can see it up there on your screen, and I will hand that off to the CKM team to play. Thanks.
Thanks, Rich, for having me, and thanks to WALIS and everybody else who helped organize this webinar. And thank you also, Marika. It's always a pleasure listening to you and your presentations. I think you illustrated perfectly the complexity of what it means to talk about using evidence to deliver and do WASH. So what I would like to share with you today are just some of the experiences that I've had working with AMCOW and WALIS and AfricaSan, and how that might help us think about what may be needed in order to use evidence in a better way, especially at a regional scale. From my work, I've seen that there are three enabling factors that I'd like to share with you today. And the first is country leadership with a clear long-term vision. There really does need to be a guiding force, and one which can reach the scale of an entire country. And the second is regional and horizontal exchanges, such as those supported by AMCOW and the AfricaSan movement, where countries can share lessons with one another. And finally, this also all comes down to defining in a really clear way some shared approaches for how to meaningfully achieve and measure progress under country visions. I'd like to share with you some of the work that I've done to strengthen country-led monitoring. And by that I mean when the monitoring, evaluation, and learning cycle is led by countries themselves, where a country determines the questions to be asked, how it will be answered, and then how that information is used. It's country-led because it encompasses different actors, so civil society, the private sector, and government roles, and ultimately comes under typically the coordination of government, but some central body. And it should encompass the entire country because we're talking about national systems. Together with UNICEF, IRC, and UCFO, under a DGIS funded program, we worked in 10 countries to strengthen national M&E systems. And we used a methodology that had already been used for strengthening national HIV/AIDS monitoring systems. That methodology, developed by the UNAIDS Monitoring Evaluation Reference Group, as well as the World Bank, included 12 different components of a functional national M&E system that are shown here as a puzzle interlocked with one another because they're all required. And it tends to also show the complexity of a well-functioning monitoring system where evidence is used. From these countries, we found that stakeholders had identified different recommendations. The factors, drivers, and triggers were different in each country. In fact, when we got to the planning stage in 8 of those countries and started working on national M&E plans, the costs also varied enormously. So it was not easy to compare one-to-one between countries. Finally, it is important to understand that whole system that Marika spoke to. Countries are not on their own. The SDGs and AfricaSan have highlighted how global and regional frameworks, structures that allow us to work together on solving big issues like water and sanitation do help to set commitments, and they do help to start to monitor progress. The AfricaSan movement is an example of one of these regional movements, which I believe has helped to stimulate the use of evidence towards really achieving sanitation goals. AfricaSan was actually was the first regional SAN movement. Afterwards came Latino SAN and Saco SAN and the other SANs. So what I'd like to highlight here is that this process has been around for quite some time, and I'm a relative newcomer. I only started actively working on the NGOR declaration monitoring in 2016. And for those of you who are new to this, it's maybe useful to know that the first AfricaSan conference helped to formulate the MDG on sanitation. The second AfricaSan conference formulated the Etiquini Declaration and Commitments, which then led to the first African level reporting where states reported to one another how they were doing against these commitments. Now, between 2008 and 2015, when the NGOR Declaration replaced the Etiquini Declaration, there were a lot of lessons that were learned about monitoring sanitation at a regional level. And what's important to know about the AfricaSan process is that it operates on two levels. There are the declarations and commitments and the ministerial meetings, which are the political track. And then there is also a technical track where country governments meet with one another, they share their reports, they share their action plans, and also ideas about how they can do better. So there's a technical exchange between countries and learning that ensues. Now, the strength of the AfricaSan movement was that it raised awareness about sanitation, it helped to increase finance for sanitation in Africa, and strengthen political willingness. Really and truly, it was an iterative process between those technical meetings and the political meetings. In 2015, the NGOR Declaration on Sanitation and Hygiene was adopted, with a vision to achieve universal access to adequate and sustainable sanitation and hygiene services and eliminate open defecation by 2030. And in 2016, I became involved to start thinking about, with AMCAO and other partners, about what kind of monitoring system and indicators could we use to learn and improve on what we had done with the Etiquini Declaration monitoring. A number of goals were set for the NGOR monitoring process, including enabling objective measures of country performance towards achieving the 10 commitments. That meant measuring performance in countries, not between countries. And the second objective was to help maintain momentum, as the Etiquini Declaration and commitments had done before. The third objective was to improve accountability, because there was a sense that with the Etiquini system, it was still possible to fudge, let's say, the traffic light indicators over time, and we saw the performance of countries improving over time, even when it seemed inaccurate in terms of the actual changes on the ground in sanitation outcomes. And the fourth objective was to strengthen links between evidence and policy decisions. So in other words, to strengthen those two tracks of the AfricaSan process with evidence from that monitoring system, which could really lead to policy decisions. And finally, the fifth was to help build adaptive learning capacity within and between sectors in African countries. So in other words, to start reaching out and touching on the health sector and looking at all those kind of cross-cutting elements of sanitation and hygiene. I'd like to share with you the case of one of the NGOR commitments, Commitment 7, to progressively eliminate untreated waste and encouraging its productive use. Each of the NGOR Declaration commitments is related to one or more SDG targets. In this case, I'd like to highlight for Commitment 7, SDG Target 6.3, to half the proportion of untreated wastewater, just to show that there's a direct link between the SDGs and the Angor Declaration. If we look at the indicator for that one, indicator 6.3.1a, we're looking at the percentage of safely treated domestic wastewater flows. So that requires estimates of the volume of wastewater safely treated, as well as the volume of total wastewater generated. Now the question is, at least in the case of Africa, since we're talking about African and the Angor Declaration, is it possible to measure this? Conveniently, the Angor monitoring indicators are set up to answer this question. So they're staged. Each commitment has stage 1 indicators, and some of the commitments have stage 2 indicators. Stage 1 addresses this question of the enabling environment for monitoring the commitment goal. So in this case, eliminating untreated fecal waste. So in this case, we ask the questions of whether there's supportive legislation in place for fecal sludge management and reuse. Is there inclusion of fecal sludge management into sanitation definitions in guidelines and policies? And is there monitoring data on untreated fecal waste? So in other words, that denominator that we needed for measuring the SDG indicator. In stage 2, we try to monitor progress against country goals. So once those country goals are defined and there's data, then we can start to monitor progress. So stage 2 indicators aren't actually answered by all countries. They're only answered by countries that have met minimum requirements in stage 1. Also, it should be noted that progress in one particular country cannot be compared to progress in another country because one country may have more stringent targets than another country. Rather, remember the goal of the Angor monitoring is to drive momentum against country targets and drive progress in countries, and thus in the region as a whole. 39 countries reported in the Angor commitment monitoring. Of those countries, there was not one that was able to track the amount of fecal waste being disposed of in the environment by having a monitoring mechanism in place. While this is a very poor finding and essentially means that none of those countries are able to track their progress against Commitment 7, it was a finding that had an impact. So is the Angor baseline delivering? Well, at the African 5 conference, where the COMISA statement was drafted, stakeholders came together and wrote that eliminating untreated waste and encouraging its productive reuse is essential for safely managed sanitation targets. However, it is currently the worst performing of the Angor commitments. These stakeholders also called upon heads of state of the African Union to declare an African-wide state of emergency on sanitation and hygiene. Together, the stakeholders have written a COMISA statement which can now go into a political process and hopefully drive change. The results are also forcing people such as myself who are involved in the technical track of AfricaSan to consider whether we forgot to address waste. At AfricaSan 5, our sessions did not address Commitment 7 directly. FSM 5, the sister conference, did not either. We also noted that many of the tools that were presented tended to be city-focused, and there weren't many looking at the national level. As we're talking about monitoring and the use of evidence, I'd like to talk about Commitment 9, which had to do with government-led systems. Out of the 39 countries reporting, only 20 countries have multi-stakeholder reviews that review SDG targets, and only 31 have national monitoring systems. 10 provide data to both national and subnational levels, which is essential. Of the 18 countries that have a monitoring system and a multi-stakeholder review, a little over a half report activities that have been adjusted and funded on the basis of those reviews and the evidence generated. The 39 countries reporting on the Angor commitments varied from South Africa to the Central African Republic, so they varied dramatically in context. But all of the countries reported missing some national targets on one or more of the Angor commitment areas, and I highlight a few that are important below. IRC organized a sub-theme of AfricaSan 5 on the use of evidence. And some of the conclusions were that political leadership and momentum are key. National policy targets need to be defined, and there need to be actions at scale in countries to drive change. There also need to be stronger national M&E systems, and the technical and financial support from partners is going to be required to achieve this. Systems should be national in scale and inclusive, and reaching everybody critically means overcoming blind spots. So that means having participatory approaches with different perspectives and using in-depth research. Finally, I'd like to come back to the big picture. When we looked at AfricaSan, we were talking about the regional level. When we were looking at national M&E systems, we talked about the country level. There is also an operational level where we also need standards, whether that's for data exchange, for example, the water point data exchange, or ISO standards for non-sewer sanitation. And there's also a need for participatory processes which link these different levels together. I think generally what this comes back to is the need for well-defined and shared approaches for meaningfully measuring progress. So in conclusion, I'm coming back to the three enabling factors. The first one is country leadership with a clear long-term vision. The second is regional and horizontal exchanges. And finally, we need well-defined and shared approaches for how to meaningfully achieve and measure progress under country visions. Thank you, and thank you for listening.
Thank you, Nick, for the presentation. We're going to move on to the next presentation immediately. You can see if this is a 1-hour webinar. To allow for a good Q&A, we will go a little bit over time, but we're going to hand things off to Kitch Bawa. Kitch is a sanitation project manager at AMCAL. There at AMCAL, he's pioneered the establishment of the sanitation desk. It did not exist before Kitch. He championed the advancement of the sanitation agenda across the continent. He's from Nigeria, and he's worked in the wash sector since 2006. For this one, this is a live presentation, so Kitch will be on the line, and you can still ask questions. I already see a lot in the box coming up, which we will go over at the end. Thanks.
Hello, everybody. I'm Kitch Bawa from the AMCAL Secretariat, and I will briefly, in the next few minutes, talk to you about the role of regional institutions like AMCAL in institutionalizing the use of data for decision-making in Africa's wash sector. Thank you, Nick, for building setting the stage for my presentation. And I would like to start with a quote from Carmen Savastano in a book called Two Princes and a King. The quote says that if our ideas are not evolving with verifiable evidence, they are not reliable ideas. And I dare to say that without a policy solution, most problems will still be major problems. So let me start by telling you about AMCAL. Rich, can you change my slide? I can't move it from here. So the African Ministers' Council on Water the Secretariat is hosted by the government of Nigeria and is an international intergovernmental agency and a subcommittee of the African Union Specialized Technical Committee on Agriculture, Rural Development, Water and Environment. And can you take me back one slide? It's moving too fast for me. Good. So the AMCAO is composed of the 55 ministers in charge of water and sanitation across the continent. And the governing council has 15 members of the EXCO who are drawn from all the sub-regions of the continent. And the Secretariat based in Nigeria is headed by the Executive Secretary, coordinating with the support of other staff and working closely with members of the Technical Advisory Committee to coordinate the affairs of the council and to chart and set the agenda for water and sanitation across the continent. So the AMCAO's work as a subcommittee of the African Union is in two streams, working towards creating evidence for decision making. The first stream is the one that deals with monitoring, which is based on the decision of heads of state at Sharm el-Sheikh in Egypt during the ordinary session, which mandated AMCAO to report on progress in the water and sanitation sector across the continent. And the other stream of work that tries to bring evidence for decision making is research, which is based on the partnership between the AU and the African Union and the new Partnership for African Development and AMCAO on water centers of excellence. But for this, today I'll be focusing more on the monitoring and reporting. So based on the Sharm el-Sheikh decision in 2008, which has within it the Ituquini commitments that were mentioned by Nick earlier, the AMCAO developed the Africa San Monitoring and Reporting System, which had started before AMCAO and the African Union started working on the water and sanitation monitoring and reporting system. So the WASMO started later on in 2011, and several reports were submitted to the African Union in 2011, 12, 13, and 14, with the MDGs for sanitation. The goal commitments are to help Africa achieve the SDGs for sanitation and hygiene up to 2015. Slides frozen. If you can hear me, can you move this? Okay, so the WASMO, which is the bigger water and sanitation monitoring system, is responding to Sharm el-Sheikh, is based on 7 thematic areas and 43 indicators. And one of the thematic areas that we are focusing on today, WASH, is theme 3, that focuses on water, sanitation, hygiene, and wastewater. And you can see on this, the next slide will show you a snapshot of how the reporting of the WASMO looks like, based on each sub-theme and based on particular indicators. So the color codes, they are color coded. The report is based on color codes. So green means there is very good progress. Yellow means there is limited progress, and red means there's no progress. To connect. Let me connect. I think it connects. It's connected. Can you hear me?
Yes, we can hear you.
Yes, but the slide is static, it's not moving. Good. So you can see this is a snapshot, a screenshot of the presentation of the reports of the hydropower utilization across the continent. So the choice of hydropower utilization is deliberate to show you that the WASMO is cross-cutting across all different aspects of water. So you talk about hydro water, water for hydropower, you talk about water for agriculture, and the rest of them. And it's too fast. I need to go back to my slide too. So I need to go. I'd like to talk about key decisions that were based on the data from WASMO. And please take me to that slide on key decisions based on WASMO data. I think it's the one prior to two slides prior to this.
This you can continue.
So there may be a slight delay in what you see, Kitch, but we're all looking at key decisions based on WASMO data.
Very good, very good. So key decisions based on WASMO data, you can see the Kigali Action Plan, the Vision 2M, 4M, and the Productive Sanitation Initiative. So let me elaborate a bit on the Kigali Action Plan. The first WASMO report had a recommendation based on 10 countries that had the least progress in access to water and sanitation. So the Kigali Action Plan was a plan developed and endorsed by the African Union to focus especially on these 10 countries to ensure that access is accelerated to water and sanitation in these 10 countries, without which they will find it very difficult to make any meaningful progress in reaching the MDGs. So you can see that at this point, the WASMO data came, the WASMO system came with data that was a tool that was used as evidence to decide on how to equitably include countries that would otherwise find it difficult to make progress in access to wash across the continent. And the next slide is on the Africa Sand monitoring, which Nick talked about a bit. Nick talked about the Africa Sand monitoring a bit, but I will talk about it from the policy point of view and from the position whereby AMCAO is working to institutionalize a system whereby countries make decisions based on evidence only. So you can see that from the Africa Sand monitoring, we have a number of indicators, about 40 indicators, and is a process for peer-to-peer learning and exchange, learning and sharing, and the outcomes of the monitoring lead to country-specific action plans. If you recall, Nick talked about countries measuring and reporting to themselves, accountable to themselves. So here, countries are expected to use the evidence from the data to make country-specific action plans. And some of these action plans can be ODF roadmaps, sanitation policies, country coordination platforms, the strengthening, establishment of monitoring and evaluation systems, and the rest of them. But specifically on how we're trying to institutionalize a system of evidence-based decision-making, you can look at, there's a commitment number 9 that focuses on establishing government-led monitoring, reporting, evaluation, learning, and review systems. And the indicator number C9C is trying to look at how multi-stakeholder reviews and monitoring data are used to inform decision-making and implementation of activities. And you can see, Nick presented that most of the countries that reported on this indicator has made very little progress on this indicator. And we hope that as we move towards achieving the SDGs by 2030, we know that for any decision to be made that will influence practice, policies need to be in place, and the decisions have to be evidence-based. And we hope that we will intensify our advocacy at country level to ensure that countries are reporting on this indicator and accelerating progress and meeting this indicator in the next 5 to 6 years, so that work can be accelerated towards achieving the SDGs. Okay. So some of the efforts that we're making that I talked about is in the next slide, which is on strengthening the use of data for decision making. The particular efforts that we're putting in place to ensure that there is coherence in monitoring and reporting at country level, to show that indicators are clearly defined, to see that data collection is well coordinated and systematically organized, and reports are produced with the expected quality. And we are also building synergy with global processes like the UNICEF WHO Joint Monitoring Program and WHO GLASS, to ensure that we work together and complement each other and do not burden member states in terms of data collection and data generation. And we're also working to build capacity. Yes, we're also trying to streamline focal points for JMP and GLASS and AMCAO goal monitoring, data collection, and WASMO, so that they work in sync to ensure that they move together. We also advocate for very strong coordination and leadership within the sector at country level, because without that, there will be no concerted efforts. People will be working in silos to work towards meeting the MDGs, the SDGs. Ongoing efforts, this is the next slide. We're working to ensure that we review the system. This is like the version 3.0 of the monitoring system, both for the WASMO is 3.0, for Africa Sun is 4.0. We're trying to review the indicators. Over the years, we've seen that some of the indicators, there is limited data because a few countries report on them. We're trying to streamline and review the indicators so that the indicators that we are reporting on, most countries have data to report on. We want to we're working to intensify peer-to-peer learning and sharing, and strengthening synergy also at global level. we're organizing a capacity building program for member countries to ensure there's data integrity, and we are strengthening the advocacy for use of for policies on the use of data for decision making, because we believe that at country level things need to be rooted in policy, and we're also advocating for a higher level decision on institutionalizing of data management systems at country level, so that it becomes systematic and part of the entire system, the process. So some of the challenges we have faced, the next slide, around the prioritization of monitoring and evaluation as a thematic area generally. So that's a huge challenge that we are working to advocate for, to scale up, to scale through. We want to, there's also inadequate data collection and processing systems at country level, and weak national coordination platform. Some of the issues I've mentioned earlier. There's also lack of ownership of the systems and the capacity for data management and reporting, and some of the focal persons for data collection tend to move around, get retired, or are transferred to other departments within the country. We want to see how a systematic process will make that transition very seamless. And then the bigger issue also is the issue of funding, of monitoring and evaluation. The standard percentage to have a systematic, an optimum M&E system functioning within the country is to have at least 10% of the budget, of the total budget for project implementation allocated to monitoring and evaluation. We want to see how funding can be improved towards monitoring and evaluation. And finally, some recommendations going forward for institutionalizing evidence-based decision making. We think that at the regional level, there's a reasonable, at AMCAO, at African Union level, and we think there is reasonable, considerable evidence-based decision making, and these need to be replicated at national level. And by this we mean that during budgeting and the planning cycle, there should be enough data from within the country that is provided to decision makers to say to affect the allocation of resources. And then we also recommend that, and it's part of the work we are doing, that the policies on water and sanitation should entrench decision making, evidence-based decision making, so that it becomes routine. And then we believe that strong coordination mechanisms are important to support data access, without which limited data will be quite difficult to access. And then we also recommend that there should be strong investments into to build capacity for data quality, and then the use of information and communication technology should be mainstream. Countries like Kenya, Tanzania, Ethiopia have moved on, and countries like Nigeria within the sub-region, which should set the pace and example for others within the region, should embrace information and communication technology. And then we recommend that regional economic communities like ECOWAS, the SADC, the ECAS should strongly key into the system of evidence-based decision making by supporting coordination within the region and mobilizing countries within the sub-region. And for more on what AMCAO is doing, you can look at our website wherein you can connect to the water and sanitation monitoring and reporting system and the sanitation bit of it. Thank you very much. Thanks to our partners, USAID, for having us share with you what we're doing to strengthen evidence-based decision making.
Great, thank you, Titch. So we've just now heard from three very engaging presentations, presenters. I understand that although it's after 11, we've gone over about our hour. We were going to hold about 15 minutes, and keep that set aside for Q&A. Just as a quick reminder, you can plug in your questions into the questions box if you see it. We already have several there. So thanks for those folks who've already plugged in. So I'm going to start with those. And one of the things, and I'm going to pluck these out as I think some are very interesting and will lead to some of the others that are here. So I'm going to start with a question from Rebecca from Ohio State University. She asked us to please discuss the issues and possible solutions around politically motivated decisions around data collection, use, and sharing. So if the presenters would like to plug in, just holler out, and let's talk about that, because I think that's a very interesting angle on this. Is it gets to the motivations that Marika was talking about, the things that AMCAO is very engaged in, and also the political motivation element around the African that Nick talked about. Would any of the panelists like to talk about that very quickly?
Yeah, it depends a bit, I guess, what we mean with politically motivated decision making. If the decision is fully politically motivated, then I would see what data is being used to kind of justify the political decision that has actually already been made. So then I would see that as symbolic use of monitoring data. So then the decision isn't really being based on data itself. The data doesn't inform the decision, but the decision is already being made, and the data is being used to justify it. And that is something that I think we see that is quite common, and that is quite often a use of monitoring data that we see in practice.
Thank you, Marika. So the question again, and I think Nick's going to plug in here, but if anyone did not hear it, it's Rebecca asked the panelists to discuss the issues and possible solutions around politically motivated decisions. So those decisions, what is the political decisions around data collection, use, and sharing? This is a fairly broad question. Thank you, Nick.
Thanks. It's a great question, and we could discuss it for hours because there's so many angles to it. But one thing I wanted to reflect on was one of the sessions that we hosted at the AfricaSan 5 conference. IDS presented rapid action learning, and they were presenting a form of rapid action learning where practitioners share with one another, for example, what works on CLTS in a particular country in a rapid manner, where within a week of a meeting, lessons are shared, social media is used, and practitioners are connected in different areas. And what was shown was that in Burkina Faso and South Sudan, for example, a variety of CLTS methods were developed rapidly that could meet different cultural needs and norms. And why did they start working on that rapid action learning? Well, it was actually the inspiration from India, where there was a strong political drive, by the Modi government to achieve sanitation outcomes. And many people that I've heard to, speaking, one-on-one have basically said that many of the figures that come out are rather inflated. So maybe this is the other way around. This is a political decision that has led to kind of a push to report better than we're actually performing in a particular country. But what that led to was a realization that, as we do need kind of some politically, let's say, motivated decisions to kind of scale activities in the sector to also scale, let's say, the demand for information and results. But at the same time, we need a way of, having objective information and sharing lessons just as quickly as those activities are scaling. So I think we need to work in lockstep with kind of political decisions. When things, as Marika said, when things become too political, then there really isn't a lot that evidence can do. But with a bit of, let's say, political drive, and also good evidence, objective evidence on one hand, but also that can be exchanged rapidly and freely with different perspectives, I think the two together can come to good results, and that the solution may be somewhere in that interaction.
Excellent. Thank you, Nick. Any of the panelists want to chime in on that one? Okay, we'll move on to another one that just popped up. It is directed straight to Kitch, although I think this also gets to another question I saw earlier. What is the relationship between the complexity of the data to be collected and the challenges faced in collecting, processing it, and then using it, or at least getting decision makers to use it? So this also gets to another one is, what data is being collected better than others? So we have the challenges on one side where there are limitations in some data and how it's collected, but then what are some data that we're able to easily capture now? So I'll hand that over to Kitch now.
Okay, let me start from the last one. I actually wanted to weigh in on the first question on politically motivated data decision making, and I think the issues of data complexity. For me, I'm a policy advocate, and I'll leave the issue of data complexity to Nick and Marika, or probably Nick to answer. But I'll focus on using the data for policy. For me, I think for us to be able to get policymakers to use data for decision making, we need to make it as simple as possible. We need to make it as usable as possible. We need to make it. They have very little time. In our advocacy, we may have just a few minutes to sit with these guys and present to them what we have. So we need to have things that really speak to them, things that really get them and move them to be able to act. And whether it's complex or not, I think it needs to be analyzed and reported, and the report be made as easily readable as possible. Whether the data will not be analyzed as one of the data that Marika talked about. If we have numbers that will prove a bit complex, we should break them down to hit the point straight up so that policymakers can use it. And having said that, let me also talk about politically motivated decision making. I think it's important for us in our advocacy plan to identify, to do stakeholder mapping. For every policy decision, there are some beneficiaries, and each of the beneficiaries try to get access so that the policy can be passed. And so if we identify the high net worth stakeholders, we can make our data available to them, even if it means to piggyback on their own benefits that will come from the policy decision. It will really go a long way in helping us to achieve our objective of getting the decision out based on the data that we have. Over from here.
That's great, Kitch. Thank you so much. Okay, so we have very little time left, but we're going to try to field one more question, and this is from Brian in Kenya. And he asks if we could please discuss any policies or regulations or procedures, maybe you call them standard procedures that guide how to select indicators for the data that we're getting, so good indicators, and talk about their characteristics and the capacities in using that data, creating it and then using that data. And that's open to all the panelists. And we have about 5 minutes left. Thanks.
So it is a bit difficult to hear. We are having a bit of problems with the audio, but did I understand right that the question is about regulations and procedures related to indicators of data?
That's it.
Okay, great. Yeah, then I think to say from my end, what's important for data to be useful for decision making is that it's the right data, that it is relevant data, and that depends very much on and what is the right data. That depends on what the data is being used for, and that will depend from level to level. Service providers will have very different data requirements than, for example, service authorities, and they will have different requirements of the kind of data, the level of aggregation of the data, etc. So so I think that depends very much on the level and on what the data is being used for.
Okay, so that's a good call out for relevancy.
And Rich, maybe I can add something. This is Nick. I think, one thing I'd like to share, or at least I'd like to share a reference. The UNAIDS Monitoring Evaluation Reference Group wrote a document called Indicator Standards, Operational Guidelines for Selecting Indicators for the HIV Response, which I think has a really nice flow chart in it for assessing indicators. And, it asks a number of questions. So one, is the indicator new? No, well then consider using an existing indicator. And then if yes, then is the indicator needed and useful? So that speaks very much to the question that Marieke was answering. So does it answer the questions people are asking, in fact? And if not, don't develop it any further. Consider alternatives. And then finally, does it have technical merit? Is it fully defined? Is it feasible to collect? If it's no to any of those things, consider alternatives. And finally, if those things are feasible, then has it been field tested or used operationally? If no, then proceed to testing. If yes, then proceed to use. So it's a really nice flow chart, but it's kind of easy to remember, relatively easy to remember, and there's a good description for each of those questions and maybe how to answer it. So that's my tip.
Excellent, thank you, Nick. So I'm told that that's all the time we have. I know there's lots of other questions up there. There's some really good ones here. I encourage everyone to follow up directly with the presenters. Their emails are there on the screen. I'd also like to say that a recording of the webinar and the slide decks are going to be available at globalwaters.org. So that will be available, and then WALIS will be blogging about this webinar soon afterwards. To wrap up, I want to thank the folks who made today's webinar possible, especially Kate Edlin and Katie Connolly from the WALIS team, and also our wonderful presenters with Kitch and Nick and Marieke. I'd also like to thank the team at the USAID Communications and Knowledge Management Project for making it happen, including Grace and Dan. Thanks, everyone, for your time.
Thanks, Rich. Thanks, Kate and Marieke and Nick. Have a good day.
Thanks, everybody. Thanks, Rich. And thanks to all the organizers.
From my side, thanks very much, and see you soon. Ciao.